Hey everyone, and welcome back to Study Nurse IQ. I'm Ginny, and today's topic is types of wound. Our skin is the largest organ we have. It's our first line of defense, our living armor. But what happens when that armor is breached or damaged? In medicine, wounds are everywhere. Knowing how to classify them is the first step in knowing how to treat them. In this video, I'll break down the different types of skin wounds in detail, give you the essential knowledge you need to ace your exams and to better understand what's happening beneath the surface. So let's dive in. First things first, every skin wound falls into one of two major categories. It's a simple distinction that tells us immediately about the skin's integrity. Wounds can be classified as being open or closed. Think of it this way. If we have an open skin wound, that means the skin is no longer intact. The protective outer layer, the epidermis, has been broken, creating a path for bacteria to enter. This is your classic cut or scrape. Conversely, a closed wound is one where the outer layer of skin remains intact, even though damage has occurred to the tissues underneath. Now that we've set the stage, let's break each one down in more detail, starting with closed wounds. These are injuries that may not bleed on the outside, but there's still a lot happening beneath the surface. A good example is a contusion, or what most of us know as a bruise. A contusion is what we commonly call a bruise. This is the most frequent type of closed wound. It happens when you have blunt trauma, maybe you bump into a door or fall, and it damages the small underlying blood vessels, which are those tiny capillaries. These tiny vessels rupture, and blood leaks out into the surrounding tissues, causing that characteristic discoloration of the skin. A contusion will be tender and can display a variety of colors: purplish, dark green, brown, or yellow, depending on the person's skin tone, and crucially, the stage of healing as the body breaks down that trapped blood. Now, a hematoma is like a contusion's more severe cousin. It's also caused by trauma, but it involves more significant damage to larger vessels, leading to a much larger collection of blood. The blood pools underneath the skin, creating a distinct, hardened lump or mass. The medical terminology is a great memory tool here. The prefix hema means blood, and toma refers to a mass or swelling. Because of the volume of pooled blood, a hematoma tends to be more painful and, in some cases, may require medical intervention to drain it. Blister. A blister is a fascinating wound. It's a closed wound because the top layer of skin, the epidermis, is still intact. However, a fluid-filled pocket forms just underneath it. This often occurs because of intense friction, like a new pair of shoes, an allergy, or a minor burn. The body creates that fluid pocket as a protective cushion for the damaged skin below, keeping the area moist and sterile while new skin regenerates. Finally, we have frostbite. This develops after prolonged exposure to freezing temperatures. It typically affects extremities, like the fingers and the toes. As the tissue freezes, blood flow is cut off, and the area can present as dark purple or even black. Remember, in cases of severe frostbite, the underlying tissues can be so damaged that unfortunately it results in the loss of those tissues. Now that we've talked about closed wounds, let's move on to the other main category, open wounds. With open wounds, the skin's protective barrier is broken, leaving the tissue underneath vulnerable to infection. There are several different types of open wounds, and each one has its own unique features. Let's start with one of the most common examples, an abrasion, often called a scrape. An abrasion is your classic scrape. Think road rash. It's a superficial wound caused by friction, scraping away just the top layer of skin, the epidermis. Because it's shallow, there tends to be little to no bleeding, depending on the depth. But here's the catch. Abrasions can be quite painful because those delicate nerve endings in the skin are exposed and irritated. Next, let's compare two types of cutting wounds: laceration versus incision. A laceration is caused by a sharp object or blunt trauma, and its appearance is typically messy, irregular, with varied depths and sizes. It's often quite bloody. An incision is generally intentionally created. Think a surgical cut made with a scalpel. Its appearance is symmetrical, neat, and has well-defined edges, making it easier to suture and heal cleanly. Another common type of open wound is a skin tear. Skin tears occur when the skin is subjected to shearing or stretching forces that literally pull the top layers apart, leading to flaps or tears in the skin. This is most common in patient populations with thinning or fragile skin, such as the elderly who have lost subcutaneous fat and collagen, or patients who have used corticosteroids over a long period of time. Puncture and penetrating wounds. Depth is the key here. A puncture wound is caused by a sharp, narrow object, like a nail or a needle, that goes through the skin. A penetrating wound takes it further, moving past the skin and into deeper tissues, muscle, or organs. Examples include gunshot wounds or deep stabbings. The primary risk here is internal damage and infection deep within the body. Finally, in this group, we have the avulsion wound. An avulsion is one of the most serious wounds. This involves the complete or partial removal of skin and its underlying tissue. It's literally ripped away. This happens in severe traumas like major car accidents or animal attacks. This type of injury carries an extremely high risk of infection and requires immediate surgical attention. Now, not every wound fits neatly into open or closed. Some are so complex that we classify them separately based on depth, severity, and mechanism. Two of the most important complex wounds are burns and pressure injuries. Burns. A question of degree. A burn is damage to the skin layers from an energy source, heat, chemicals, or electricity. These classification depends on depth. First-degree burns, superficial. These are closed wounds. They only affect the epidermis. The skin is red, painful, and warm, but there are no blisters. They typically heal quickly. Second-degree burns. These are open wounds. They affect the epidermis and the dermis. This is where you see the classic blisters, redness, and significant pain. They may require grafting if severe. Third and fourth degree burns, full thickness, deep full thickness. These are also open wounds and affect all skin layers, often extending to fat, muscle, and even bone. Nerves are destroyed, so surprisingly, they may be less painful at the center. They often appear black or charred, contain eschar, dead tissue, and always require grafting and months of healing. Pressure injuries, pressure ulcers, the staging system. These develop from unrelieved pressure on the skin, usually over a bony prominence or from a medical device. This sustained pressure cuts off circulation, causing the tissue to die. We use a staging system to describe the severity. Stage. Classification. Key characteristics. Open-closed. Stage 1. Non-blanchable redness, skin intact closed. Stage 2. Partial thickness skin loss, blister or shallow ulcer open. Stage 3. Full thickness skin loss down to fatty tissue, edges may roll, open. Stage 4. Full thickness tissue loss exposing muscle, tendon, or bone, open. Unstageable. Covered by slough or eschar, so the depth can't be assessed, open. Chronic wounds. Up until now, we've been talking about wounds caused by external trauma, scrapes, cuts, tears, burns, or pressure. But not all wounds come from an outside force. Some wounds develop because the body itself isn't able to heal properly. We call these chronic wounds. The underlying issue is usually poor circulation, which prevents oxygen and nutrients from reaching the tissue. The two most common examples of chronic wounds are venous ulcers and arterial ulcers. Let's start with venous ulcers. Venous ulcers form due to poor venous circulation, meaning the venous system is failing to drain deoxygenated blood back to the heart. This causes blood to pool or stagnate in the extremities, leading to tissue damage. Appearance: swollen, high amounts of drainage, irregular edges, shallow depth. Location: most common on the medial lower legs and ankles, the inner side. Skin dry, itchy, and may have pigmentation changes. Next, we have arterial ulcers. Arterial ulcers form due to poor arterial circulation, meaning the arterial system is failing to deliver fresh, oxygenated blood to the tissues, causing them to become ischemic and die. Appearance: very little drainage, often pale or containing necrotic tissue with a deep, punched-out shape and well-defined edges. Location: found most commonly on the toes, top of the feet, and lateral ankles, the outer side. Very shiny and hairless. Pain: these ulcers are typically quite painful. That was a lot of crucial information. To solidify your understanding and get you ready for those nursing exams, let's go over 3 NCLEX-style questions based on what we just covered. Question 1. A client presents to the emergency department after falling off a bicycle, resulting in a large area of superficial skin damage on their left thigh. The wound is painful, has minimal bleeding, and exposes nerve endings. The nurse correctly classifies this wound as which of the following? Incision, laceration, abrasion, avulsion. Answer: abrasion. Rationale: an abrasion is a superficial wound caused by friction, scraping away the epidermis. It is characterized by minimal bleeding, but can be painful due to exposed nerve endings. An incision is a neat, intentional cut. A laceration is an irregular, deep cut, and an avulsion involves the ripping away of tissue. Question 2. Which of the following wound characteristics is most indicative of a venous ulcer rather than an arterial ulcer? A. Deep, punched-out shape with little drainage. B. Location on the lateral ankle or toes. C. Surrounding skin is shiny and hairless. D. High amounts of drainage and irregular wound edges. Answer: D. High amounts of drainage and irregular wound edges. Rationale: venous ulcers result from blood pooling, venous insufficiency, and are characterized by edema, high drainage, weeping, and irregular, shallow wound edges, typically on the medial leg ankle. Arterial ulcers, A, B, C, result from lack of blood flow, ischemia, and are deep, punched out, have low drainage, and are found on the toes or lateral ankle with shiny, hairless skin. Question 3. A nurse is reviewing a patient's chart and notes a stage 1 pressure injury over the sacrum. The nurse understands that this wound is classified as which of the following? A. An open wound because tissue damage has begun. B. A full-thickness wound with visible subcutaneous fat. C. A closed wound because the skin is intact. D. An unstageable wound because the depth is unknown. Answer: C. A closed wound because the skin is intact. Rationale: by definition, a stage 1 pressure injury is characterized by non-blanchable redness with intact skin. Because the protective epidermal barrier has not been broken, it is classified as a closed wound despite the damage to underlying capillaries. Stages 2, 3, 4, and unstageable are all open wounds. All right, that wraps up our detailed look at the different types of skin wounds. From the smallest bruise to the most complex pressure injury, you now have the tools to identify and classify them correctly. If you'd like to see more videos in this series on wound care or other nursing fundamentals, be sure to check out our YouTube channel at Study Nurse IQ. And while you're there, drop a comment below. Tell me which type of wound you find the most challenging to differentiate. Understanding these distinctions is crucial, so don't hesitate to ask your questions too. Thank you.